Hello guys, welcome to my YouTube channel. This is Mridu. In this video, let's learn about brachial plexus and its branches. Brachial plexus, how this is formed when there is a spinal nerve coming from the vertebrae. Let's say this is the vertebrae. The spinal nerve which is coming from the vertebrae divides into dorsal rami and ventral rami. So brachial plexus, this is formed from ventral rami of spinal nerves. So we have roots, that is the C5, C6, C7, C8 and T1. These are the roots of brachial plexus. So these roots combine. Let's say the upper two roots C5 and C6, they combine and they form the upper trunk, and C7 it continues as the middle trunk, and C8 and T1 it combines and forms the lower trunk. So these are the trunks. So this is the upper trunk, this is the middle trunk, and this is the lower trunk. These trunks divide further into dorsal root and ventral, dorsal and ventral divisions, so this is dorsal, this is ventral, this is dorsal, ventral, dorsal, ventral. These are the divisions. So what we have to do now is, first we'll deal with the ventral divisions. So the ventral division of upper trunk and ventral division of middle trunk, they combine to form the lateral cord. And the ventral division of lower trunk continues as the medial cord, and the dorsal divisions of all the trunks, upper, middle and lower trunk, they continues as the posterior cord of brachial plexus. These are the cords. This is how brachial plexus is formed. So now let's see the branches from the roots. C5, it gives two branches. One is nerve to rhomboides, and another one is accessory phrenic nerve. And C5, C6 and C7 roots together, they give a nerve to serratus anterior. Serratus anterior is a muscle which arises from the lateral aspect of the ribs, and it gets attached on the costal surface, medial border of scapula. So, and then we'll see the branches from upper trunk. This is the trunk, upper trunk branches. So this upper trunk gives two branches. One is suprascapular nerve, and another one is nerve to subclavius. This point in the upper trunk from where these two nerves arises, this is known as Erb's point. That's it. Except from the cords, we know that the cords give branches. We have five more nerves which are coming from other side of the brachial plexus. That is, from the roots there are three nerves arising. One is from the C5 nerve to rhomboidus muscle, and another one from the C5 root is accessory phrenic nerve, and from C5, C6 and C7 together they give a branch that is nerve to serratus anterior. So now let's see the branches of posterior cord, lateral cord and the medial cord. So we'll start from lateral cord. Lateral cord is formed from upper and middle trunk. So it will be having a root value of C5, C6, C7. What are the branches of lateral cord? There are three branches of three nerves which are arising from the lateral cord. That is lateral. Two nerves, it starts from lateral cord. It is starting from lateral itself. Lateral pectoral nerve, lateral root of median nerve, and one more is musculocutaneous nerve. These are the three branches which are three nerves which are arising from the lateral cord, and their root value is C5, C6 and C7. And now we'll go with the medial cord. Medial cord is formed from the lower trunk. Lower trunk has the root value of C8 and T1. There are five branches which are arising from the medial cord. Five branches that are arising from the medial cord. They are, first is the medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and the last one is, how to remember this is, all this starts from the medial. So medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of arm and medial cutaneous nerve of forearm. And we know in hand, that is in the upper limb, ulnar nerve starts from the medial side. Ulnar nerve is located in the medial side, so it is a branch of medial cord. Ulnar nerve. So all these are the branches of the medial cord. The first four, they have the root value of C8, T1. Whereas the ulnar nerve, it is having the root value C8, T1, and along with that, it also receives C7. So the root value of ulnar nerve is C7, C8 and T1. Next, we'll go with the posterior cord. Posterior cord, it is formed from all the roots, that is C5, C6, C7, C8 and T1. All the roots, they form the posterior cord. So we have five branches in the posterior cord as well. From the posterior cord, they are, first one is upper subscapular nerve, lower subscapular nerve, then axillary nerve, then nerve to latissimus dorsi, and the last one is radial nerve. So how I remember this is, I'll remember the scapula and then comes the axilla and then is latissimus dorsi and then is radial nerve. So scapula, Upper subscapular nerve, lower subscapular nerve, axillary nerve, then comes the axilla, and then it is latissimus dorsi. So from the top of the body till the trunk. This is how I remember it. And radial nerve. Now see the root values. So upper subscapular nerve, lower subscapular nerve and axillary nerve, they have the root value of C5, C6. Now the latissimus dorsi, it has the root value of, we have to start from the next root, that is C6, C7 and C8. And the radial nerve, it is having the root value of C5, C6, C7, C8 and T1. That is from C5 to T1. It is having the root value C5 to T1. Why? Because the posterior cord, it continues as the radial nerve. That is why it is having the root value of C5 to T1. Thank you for watching this video. For more content, please subscribe and click on the like button.